Hi, my name is Sonari Singh, and today we'll be discussing medicine in Argentina. Now, the way I found Argentina as well for my subject for my project, I was actually researching or trying to find different actually good healthcare systems in Latin America, and Argentina picked my mind, I found it when because Argentina is actually known for having the best medical practices there is. Sorry about my dog. All right. So for our table of contents, we have our history. So we'll be first discussing the start of Argentina. Then next, we'll be talking about the earliest forms of medicine. Our second part will be based on inventions and inventions that were created in Argentina that actually have affected worldwide. Next, we will be talking about the healthcare system, the one that is in Margin, Argentina, and then we will be talking about different diseases that have been found in Argentina throughout the history and then compare it to modern. So let's get into history. So in the beginning, there's actually little to none information about the natives that actually inhabited Argentina. The only information we have is that when the Spaniards arrived to Argentina, the area was in ruins because they can only make an inference that the natives that did inhabit the area, there was probably a war and that took place, and then none of the natives actually wanted the area anymore. So the reasoning for the Spaniards' arrival was actually for search for land and silver. One of the explorers, Giovanni Cabot, he actually named the land Terra Argentina, which is known as the land of silver. And his son, Sebastian Cabot, he actually named the main leading river, which is actually arrowed out into the PowerPoint, the Rio de la Plata, which means River Plate. So Rio de la Plata became its own trading port and created export for beef and illegal trading goods. And in May 18th through the 25th in 1810, the May Revolution had taken place, and it started Latin Americans to actually want to gain independence from the Spaniards. Now, the May Revolution was actually when Europeans tried to come down to Latin America, and they were going to take over the land from the Spaniards. But however, the people that lived in Argentina, or the Spaniards that actually inhabited Argentina, they actually fought back and they won and beat the Europeans. From this on, Argentina actually gained their independence, their Declaration of Independence, July the 9th, 1810. So for our medical history, hygiene emerged in the 19th century, and hygienists, public health, and saw machinery emerged. With the new medical practices emerging, Argentina began to modernize, which created new changes for the country. There was a rush of immigration. It increased the population, and it caused crammed housing, which actually made an effect of various diseases spreading throughout the neighborhoods and emerging. So because of that, they decided to build a school for medicine known as the University of Buenos Aires. And the new medical students that actually attended the school, they wanted to revise the curriculum at the school, and they wanted to focus more on public health and anthropology. So with the new increase of international doctors, they came with many new ideas and introduced their own home practices to Argentina. And some doctors were actually able to travel to Europe and the United States to gain more information and learn their teachings, while others actually relied on traditional medical journals that were actually translated. All right, so with more information and studies, a few doctors entered politics, and they actually used their power to better Argentina, such as the living conditions, the sewer lines, and water. While others who actually stayed in the field, they actually were studying more diseases that was in the area. In 1880, the National Department of Hygiene was formed, and it was supervised by the ministry to actually make the people of Argentina care more about their health. That same year, the government actually federalized the city of Buenos Aires. In 1886, the University of Buenos Aires established a chair for mental diseases. However, the board would change into a research facility for neurology and clinical psychiatry. Through the 1920s and 30s, it became the focus of psychoanalytics. Psychoanalytics is the study that past experiences actually make up who you are during your present experiences. Though there is actually a lack of information from the 1940s until the 2000s, I was not able to find any information. But as of today, the healthcare system in Argentina is divided into three main groups: your sectors, your social insurance, and your private services. And today, public healthcare is actually free. In this photo, I chose to add Cecilia Garrison. She's actually the first female doctor in Argentina. So I actually have a clip for the healthcare system, the cons that are appearing in Argentina. In the video, it's talking about how a young man or a young boy, he has cancer and he's unable to get his medication due to the healthcare system in Argentina is declining. And many people find it being a situation or a challenge or being problematic due to the new president, Javier Milei, as he is seen to not really care more about what the people need, more so cared about his own power and wealth. Next up, we have inventions. All right, so the fingerprint classification, it was created by Juan Vuittic in 1891, and basically he actually used the fingerprint for his to solve one of the cases where a woman was trying to frame her neighbor for killing someone, but they were able to gain or learn that it was the woman who actually committed the crime by grabbing her fingerprints from the crime scene. And fingerprint classification is actually used worldwide, and it helps so many cases to this day. Next would be blood storage and transfusion. It was created by Luis Gatto in 1914. He wanted to be able to store blood without making any or having any clots in the blood. So he created the blood storage, and as of today, it actually enables blood banks, and it makes it safe for surgeries throughout worldwide, everywhere. Next would be the helicopter system. It was created by Raoul Patrice de Bekarsky in 1960. He actually made the first control system helicopter, and as of today, they actually use it for reliable transportation for many patients to and from hospitals worldwide today. And it can be seen throughout many different shows such as Grey's Anatomy, Chicago PD, and many other shows. Next is the ballpoint pen. It was created by Larios Jose Biro in 1938. He actually created because he had a difficult time using fountain pens. So him and his brother actually created the ballpoint pen to make it a little bit easier for everybody, and everyone uses it. I mean, I even used it to gain the information down for this whole entire project. So I'm very grateful that he decided to create this instead of fountain pens. The next would be the Digital Pioneer Spanish learning device. It was created in the 1990s and is actually used present by Romina Delgado, and it actually is a device that you can use to help communicate with people from Spanish to different languages. And I would see that as being very useful, but because today it actually helps with modern, what we use like Google. Google helps with it and everything like that. It just shapes. So our next topic will be our healthcare system. So I would like to talk about our projects in the making. We have the Borgen Project. Now the Borgen Project, it actually gives a 35-day window for the maximum days a patient can wait until they receive their appointment. It was actually created due to many people falling out of the private system healthcare into the public, because the public is more free than the private. There is a con with the project because the thing is that there's rural and there's urban areas, and with the rural areas, it's going to be a less population, so it equivalents to less bedding or less beds in the hospitals compared to an urban. With the urban, there's a more population and there's going to be more beds and more hospitals. Next, we will talk about the Proteger. Now, it's a project for protecting vulnerable people against non-communicable diseases project, and it's aimed to actually strengthen Argentina public health facilities of non-communicable diseases for a specific minority group. The project is already created. It's been created since 2019. I did add it because they're actually still getting more statistical data about it and everything like that. Next topic is our diseases. So, past medical diseases, from 1867 to 1895, an epidemic broke out known as chloruria. It's actually a bacterial infection spread through contaminated water and food, and it causes severe diarrhea and dehydration. Throughout this, the yellow fever broke out multiple times in 1871, and it's actually caused through mosquitoes. Also, the country experiences other diseases such as tuberculosis and malaria around that time, and it was a real huge time for deaths that was going on. So these are statistics that are in Argentina at the moment. So we have our non-communicable diseases. They're actually long-term conditions that aren't caused by infections, and they aren't easily transmitted. So our non-communicable diseases are our cardiovascular diseases, and 34% deaths occur from them. Cancer, which is a 21% in Argentina. And then next we have is respiratory disease, which is actually a 7%. For our communicable diseases, they're actually illnesses that can spread from person to person, animal to animal, and animal to person. And we have our Zika virus, which is 40%. That one's actually caused by mosquitoes as well, just as the yellow fever. In our 19th percentile is hepatitis A and B. And then in our 10th percentile, we have yellow fever because it's not as common as anymore. All right, and that's actually the end and the conclusion of my presentation. Here are my works cited. I hope you find this very acceptable and everything like that. And I would like to say thank you for the time you took to actually teach us and everything like this. And hopefully you were able to grasp onto my teaching to you of medical histories in Argentina. Thank you.